everyone and welcome back to my channel. If you don't know me, then my name is Lucy and I'm a 4th year medical student studying at the University of Nottingham. Today's video is going to be a Q&A all about medical school. I let you send me questions on my Instagram, and so I'm going to be going through and answering as many of them as I possibly can. If you want to get involved with any future Q&As or any other sort of polls I do on my Instagram, then go and follow it. It's LucyBrettX, and I also post updates about my life at med school and also tips if you are starting med school or you're thinking of applying, so go and check that out. In case you don't really know what's going on with me, then I am in my 4th year and I've started my 4th year placements. I'm not actually based in Nottingham this year, I'm based at different hospitals outside of Nottingham, and I've started my placements at a hospital in Boston, which is about an hour and a half away to 2 hours away. So quite a few of the questions you've sent in are actually kind of about placement, and so I feel like I'm finally in a position where I can actually talk a bit more about clinical placement, because obviously before now I haven't actually done placements really before. Missed my 3rd year placement because of COVID. So yeah, placement is still very new to me, but I can still attempt to answer the questions that you've sent in about placement, if that makes sense. So let's get started. So the first question is hardest thing at med school. So what is the hardest thing about med school? I think if you break med school down into its different components, so for example learning anatomy and learning your clinical skills to get assessed in OSCEs, or going on placements, meeting patients, if you break everything down, then each thing individually is quite manageable. But what makes med school so difficult is that it's just, you have to just do everything at once. So while you're meeting patients for the first time and you're learning to sort of be professional and you're learning how to communicate with patients and how to examine patients, while you're learning all of that, and that's a massive learning curve, you're also having to learn like an entire anatomy textbook, and you're also having to learn all the sort of core content from your lectures and keep on top of that. And particularly in the clinical phases, you're having to really you're just thrown into this brand new environment. I think the tricky thing about med school is trying to keep all of your different skills and all of those different areas ticking along and motivating yourself to stay on top of the work, if that makes sense. And so it's kind of this constant having to sort of divide your energy and divide your attention between all these different components of medicine that makes it such a challenging course. So the next question is, what do you enjoy most about med school? And that's a really nice question, and I think I would just say, it sounds obvious, but just the actual learning, like I just find everything that we learn just so interesting, and it's just so nice that it will actually directly mean that one day you will be hopefully positively impacting someone's life. And it's also having the ability to apply your sort of theoretical knowledge in a practical way, and that's something I've been really enjoying when I'm on placement, because I'm not just learning facts for the sake of it, I'm actually learning things to be able to then know what questions to ask patients and what management options different patients will have and things like that. And yeah, I think one of the most rewarding things in med school is when you're talking to a patient and they just sort of say their symptoms and you just kind of think in your head, oh, I think this is what the diagnosis is, and then it turns out to be right. And yeah, it's the combination of talking to patients and learning the knowledge and just sort of constantly getting to combine those two that I really love about med school. So the next question is, what do you think is unique to medicine at Nottingham? 2 things. First is full body dissection, which isn't unique to Nottingham, but not many medical schools do offer full body dissection. So that is where you have a cadaver, so a dead person, and you're in a group, and you, throughout 2 years that you learn anatomy, you are dissecting the same cadaver, and you literally work through the entire human body in the same person. And I think that's definitely something that a lot of Nottingham medical students really enjoy, as opposed to having prosections. Also, something that is very unique to Nottingham is the medsoc degree. Probably heard me talk about this so much before if you've watched any of my videos. So in your 3rd year you undertake a research project, and in completing that research project it means that you gain an extra degree, but the course is still only 5 years long. So whereas in other medical schools you have to intercalate and you have to take a year out to do some research, at Nottingham you can just do that research and your course still finishes in 5 years. So it's sort of like you're almost getting this extra degree, but you're not doing the extra whole year. It does mean that the degree is worth slightly less points when you come to applying for a foundation job, but that's just nothing to worry about at this stage. It means that you get to do some research, but your course is still 5 years. I think that's a really good feature of Nottingham. So the next question is revision resources, question mark. If you mean revision resources for medicine, well, I have used quite a few and actually made a whole video about all of the resources I used from first year to third year. So if you haven't watched that, then I'd recommend going and watching that. But essentially the main thing I did was use the lecture material to just make my own sort of revision notes, my revision flashcards and my posters. I also use various websites, so Teach Me Anatomy. Now I'm doing Obs and Gynae in fourth year. I'm using Teach Me Ob-Gyn, which is kind of the Obs and Gynae version of Teach Me Anatomy. Something I found really useful as well is Zero to Finals, and it's a free website that you can just go and use, and it has really sort of concise notes on all the different topics. So if you just want to quickly look something up while you're on placement, or you just want a sort of very concise summary of a certain like disease, then I would recommend looking on that, and that would actually be useful to use to make like your revision flashcards. I've actually been using it to make my Obs and Gynae flashcards. But yeah, the majority of my sort of revision resources are just things that I make myself, so my notes and my flashcards and my posters and things. I just find that if I've made them, I kind of remember them better, and I can kind of lay them out in ways that make most sense to me. Okay, the next question is, what tips do you have for students starting placement? Is there any preparation we should do? I would say that ideally you would go into a placement and you would know the background knowledge, and in a way I think the whole COVID situation kind of, although it interfered with our course a lot and it meant we missed so much of our placement, what it did mean is that we got to learn so much of the knowledge before we went on to placement. So for example, when I start my psychiatry placement, which is my next one after Obs and Gynae, I've actually already covered all the material. I'm familiar with the sort of different disorders and the different management options and the investigations and the medications, and I kind of will know the background knowledge, so that hopefully when I go into placement it will kind of, everything will make a bit more sense. However, that is not the case for Obs and Gynae, and I've gone into it sort of feeling quite overwhelmed because there's so much that I don't know, and there's so much that I've sort of not really covered before. So if you can obviously prepare, that is helpful. So for example, if you know you're going to a gynecology clinic, then it's definitely helpful for you to look up some gynecological conditions before you go to that clinic, so that when someone comes in with some symptoms, you can kind of just think in your head, oh, like what could this be, and like what might the doctor suggest they do. But at the end of the day, your placement is meant to be a learning experience, so you shouldn't feel like you need to know everything. And I think that's something I've kind of had to adjust to, that it's okay to just sit there and just sort of wonder what's going on, because that's when you can just ask questions. And often the answers that the doctors will give you are more valuable and more memorable than anything that you're just going to sort of read in a textbook. I would also say that you just need to have confidence, and if you're not really a confident person, or if you're a bit shy or a bit of an introvert, like kind of how I am sort of sometimes on placement, you just need to kind of like pretend that you are confident, and you just sometimes have to just walk onto a ward and you just have to say, hi, I'm a med student. Is there something I can do this morning? Can I talk to a few patients? Can I examine some patients? And you just kind of have to ask, because if you're very shy and you just kind of cower in the corner and you don't put yourself out there, people aren't necessarily going to come over to you and give you jobs to do and give you things to do and things to see. You just have to be brave and just ask for the opportunities, because if you ask, you will get. And an example of this is literally yesterday, I was in a gynecology clinic, and the doctor was basically just examining pretty much all of the patients that came in, and I just plucked up the courage and said, is it okay if I examine the next patient, as long as I've obviously asked the patient if that's okay? And the doctor was just like, yeah, of course, and I'll supervise you and I'll help you out if you get stuck. So if I hadn't have asked that, I might not have got the opportunity to. So it sounds really obvious, but just ask. If you want to do something, you want to practice something, just ask. Okay, the next question is, what is hospital accommodation like? And my answer to this is that it's pretty much exactly the same as university accommodation in first year. So my room is pretty much identical to the room I had in halls when I was in first year at Nottingham. So my room is just like a single bed, and it's got an ensuite, and it's got a desk, it's got all the sort of main essentials that you need, and then there's a shared kitchen and a sort of shared living area. So yeah, I mean, it is basic, it's not like an amazing accommodation, but it does the job, and you know what, I think it's actually quite nice. Okay, the next question is, do you or can you buy your own scrubs? So I'm pretty sure you could buy your own scrubs, but because of the COVID situation especially, but I think this is just true anyway, you'd have to wash them every single day because you can't sort of keep like going back into your home and then wearing the scrubs again into hospital, because you'd then be contaminating like things on the ward. So what we do is every morning we go to the linen room where there's just loads and loads of like stacks of scrubs, and we just take a pair and then we change on the wards, and then when we finish on the wards we change again and we put our scrubs into a linen bag and they get washed. So I don't actually own the scrubs that I wear, I just go and pick them up every morning and I take them back at the end of the day, and I'm pretty sure that will be the case most hospitals. They might ask you to kind of get your own or have your own with you, but yeah, I think you would always need to be changing before you go onto the wards, but I'm not entirely sure. Next question, is the Nottingham medicine course quite researchy like Oxbridge? Well, it's researchy in the sense that you have to do a research project. Like, it's just embedded in the course, everyone does a research project. So if you really don't want to do research, then maybe you might not think about applying to Nottingham. However, it is only a 3-month project, so, well, we started it in I think October, November, December, January, and handed it in January. So yeah, it was about 3 to 4 months. While you're doing your research project, you also do learn sort of like research-like modules. So you do a module that's kind of like about statistics and about literature reviews and things like that. But I just sort of found that was just quite useful information to know, and although you might not think you will ever go into research, you just don't know. And I think in the future, if you did then think actually you are interested in research, it's good to kind of have the foundations laid, and I think that's what Nottingham kind of does for you. Like, it just taught me how to search for literature and how to interpret studies and how to kind of write your own research papers. So I think it gave me some really good skills, but it wasn't overly researchy. The majority of the course is very clinical. Next question is, medsoc sports versus uni-wide sport, what's sustainable? Now, I think it's very sustainable for you to actually do uni-wide sport. I know people who are in the sort of the uni sports teams as opposed to the medicine sports teams. Most sports anyway run on a Wednesday afternoon, and Wednesday afternoon is always an afternoon off, at least until you reach clinical phase. You're always able to go to the uni-wide sports clubs and societies, but I think people quite enjoy the medicine ones because firstly you're with your course mates, so it means you get to know sort of your course mates and you get to know medical students in other year groups as well, which is nice. But yeah, I think it's definitely sustainable for you to be in like the uni team for something if you wanted to be. It's just up to you really, and it's just the way that you manage your time. But yeah, I would say that it is. The next question is how to cope with online lectures all day instead of getting the energy from attending real ones. So what I would say to this is that actually attending real lectures like in person was actually very tiring, and often it didn't sort of give me energy, it actually made me incredibly lethargic. If you're sat in a lecture theatre from 9 to 5, that's a lot of hours to just be sat in a room, and I think actually you could use online lectures to your advantage. So especially if they're not going to be sort of live and they're going to kind of just be put online for you to work through at your own pace, then I think that will be really great for you actually, because you can take breaks when you need breaks, you can go out for a walk or run or something if you're feeling like you're losing motivation, and that can really help you to focus again. But yeah, I do understand what you mean in that you won't be going into the lecture theatres necessarily, and you won't be sort of seeing your sort of course mates there, and so that might sort of become quite challenging. But I would say just to sort of keep in contact with your other course mates, maybe you make a big group chat or something. If you are able to sort of meet up with course mates anywhere in sort of small groups, if your university is allowing you to do that, then that would be good as well. So you can kind of study together, maybe you could do the online lectures together, just so you don't feel like you're kind of isolated. But yeah, I think there are definitely pros and cons, and you probably will find that you can use online lectures a lot to your advantage, but at the same time, yeah, I do understand why you'd be kind of worrying about the fact that it's going to be all online. Next question is, what is your normal study routine like? And this has changed a lot. Again, I've made a video about my sort of study routine before, so go and check that out if you want a sort of more in-depth answer. But essentially what I did for my first few years of medical school, when it's before the clinical phase started, is I would go to my lectures and then I would come back, and in the evenings I would spend time going over the lecture material and making my revision notes and consolidating what I've learned, making some nice revision resources and revision flashcards, which I would then revise with nearer to exam time. Now I'm kind of doing a similar thing, I guess, on placement, where I'm spending the day sort of on the wards or in clinics, and as I'm sort of hearing things and like I'm learning about new diseases and things, I'm writing them down in a notebook, and then when I get back I'm kind of using online resources and notes and things to kind of learn about them from scratch. And we do have some online lectures as well that we have to work through, and some teaching sessions as well. So I'm kind of like combining things I'm seeing in real life with kind of resources to make some flashcards, and I use Quizlet at the moment. So then I can not only go through my flashcards when it comes to exams, but I can also be going through them throughout the year so I don't forget things, because fourth year is a long year, lots of different placements, and I want to kind of keep refreshing my memory on things I've already done so I don't just completely forget it by the time it gets to exams. Next question is favourite subject and why. So if you mean in medicine, I would say at the moment I'm actually loving obs and gynae. It's a really interesting topic. I'd also say like neurology, so anything to do with the brain I find really interesting. 2 of my optional modules and my dissertation were on topics in neurology, so yeah, I've sort of learned to love neurology quite a lot. If you're talking about before medicine, then at school I would say my favourite subject was probably biology. So the next question is it necessary / useful for a Nottingham medical student to get a car for year 3 for placements? I'll answer this sort of in regards to Nottingham, but I think it would probably apply to most medical schools. The answer is that you don't ever sort of need a car to the point where if you don't have a car you just can't go to placement. But I would say, like, if I was getting the train to Boston every week, it would be a lot more difficult because often the hospitals aren't really near to the train stations. So yeah, that might be quite challenging if you have to kind of commute to a train station and then you have to get from the station to the hospital. But a lot of people you'll find will have cars anyway, so if you don't drive or you don't want to bring your car to your university, then it will be very easy probably for you to car share. Okay, next question. How to tackle nerves for your first placement? It's a weird one because I did definitely feel nervous. Even when I first ever went into a hospital ward and had to speak to a patient, I did feel nervous, but I kind of just, this thing comes over me where it's like, I just have to do it. Like, I just have to walk onto that ward and I just have to introduce myself to that patient, and if I don't, then I'm never going to get better at it. And it just goes for everything. Everything new that you ever do at medical school when you're on a placement is very daunting, like examining a patient for the first time or learning a new sort of procedure. It's always going to be scary, but you just have to do it, because if you never practice and you never give yourself the chance to practice it, it will always stay scary. So that's kind of my thinking. Taking blood from a patient, I just thought, well, I just have to take this opportunity to do it now, because at some point you're going to have your first time of doing something, whether that's taking blood or just taking a history or examining. You're going to have to do it for the first time at some point. So my theory is kind of like, as soon as you feel sort of like you've learned the skill well enough, obviously don't do it if you don't know what you're doing, you just need to practice. And just remember that no matter how scary doctors might seem, or like consultants who grill you and ask you loads of questions, everyone has been a student before, and it's just maybe that it's been a long time since they were students, but they have all gone through the same thing. And most people on the wards and in hospitals are really, really nice and just really want to help you, and they want to give you the best chance to learn. And that's how I view it as well. Like, if there is a consultant who's asking you loads of questions and really testing your knowledge, instead of thinking, oh, this is so scary, I just don't want to do this, it's good to think that actually this is a really good learning experience for me, and I'm really lucky to be tested by a consultant who is like an expert in this area. So try to think of it less as a scary thing and more of a sort of exciting thing. Next question is, what are the exam patterns at Nottingham? Multiple choice questions or something else? So pretty much every year you will have multiple choice exams. The only exams that aren't really multiple choice are if you do essays, but the essays are mainly for sort of optional modules. So you only do like a couple of essays a year, if that. Your dissertation obviously is a dissertation, so that's one way you're assessed. And other than multiple choice, it's kind of, we don't really have many written papers. We have sort of little elements of written stuff here and there, but not really. And OSCEs is the other way you're assessed. So it used to be every single year you did an OSCE, so first year, second year, third year, fourth year, fifth year. I think now they've taken out the first year OSCE, so you don't do one in your first year. But yeah, every other year you will do an OSCE, as long as COVID doesn't stop your OSCE, like what happened for us. But yeah, an OSCE is basically you rotating around different stations with a time limit on each one and having to show your competency in a certain skill or in talking to a patient, so your communication skills, or sort of doing like basic life support, doing the different examinations, abdominal examination, cardiovascular examination, respiratory examination, taking blood pressure, and all the different skills you will learn in OSCE is where that is assessed. And in the later years it sort of becomes more, you have to kind of give a sort of potential diagnosis, you have to sort of lay out the management options and things, but that's kind of later on. Your first original OSCEs are kind of more just testing the basic skills, but the bulk of exams, it is multiple choice. How do you cope with the large amount of contact hours medicine has versus other degrees? I think one way I've sort of learned to cope with it is that when I'm in medical school, wherever I am, in the lecture theatre or placement, I'm there sort of, let's say 9 to 5 or 9 to 3 or something, and in that time I'm just really trying to focus. I'm doing sort of the majority of my learning, and then when I come back in the evenings, that's kind of like time to relax. And although yeah, I do need to go over the lecture material and revise it and make revision notes, essentially we don't have to do work outside of the lectures, if that makes sense. So it's not the same as like English, for example. You might only have a few contact hours in your seminars or whatever, but then when you are coming out of those seminars, you actually have to then go back and write loads of essays and you have to read lots. Whereas medicine, I feel like it's more, anything you do when you're not in lectures is like an additional thing for you to revise or to consolidate your learning. You're not having to sort of leave the lecture theatre and then read like 1,000 textbooks. Everything you need to know is kind of in the lectures, apart from anatomy. So I guess in a way it's quite nice because it means I have a very structured period of the day when I'm doing my work and I'm learning, and then I have the rest of the day which is kind of for me to relax and to do other things, go to sports clubs and societies. So I think that's sort of, viewing it in that way has worked really well for me, rather than thinking, oh, it's so unfair, I'm in lectures all day and other people aren't. I quite like the structure and sort of organised, you know, I know what I'm doing each day. Worst parts about placements, I think the thing I've struggled with most is the lack of structure in a way. So for example, the last week I spent in Boston, we had teaching in the morning, and then in the afternoon it was kind of like just go onto the wards, go into clinics, just do what you want. And I think having to decide what you want to do is something I find difficult, because it's not that structure of, okay, now I've got a lecture on anatomy and now I've got a lecture on pharmacology. It's much more sort of, you go do what you need to do to develop the skills you need to be a doctor. And it's like a responsibility, it's that big responsibility for your own learning. So it's almost like, you could just go home if you wanted, you could just go and sit in your room, you could go to a clinic, you could go onto a ward and speak to patients, and it's just kind of sussing out what is going to be most useful for you each day. And also I guess it's just quite daunting being a medical student when all the doctors and the nurses and midwives are kind of all really busy doing their jobs, and you do get this feeling that you're kind of in the way, or people don't really want you there. It's sort of like, oh, medical students asking me questions. Last question I'm going to answer is, when you're away on placements, do you feel like you're missing out on stuff back in Nottingham? And well, I can't really answer this because I haven't really been away for that long. I've only done a week in Boston. But yes, I can imagine that being on placements, sort of residential placements away from Nottingham, I will feel like I am missing my house in Nottingham, my housemates here, and just sort of the Nottingham sort of city centre and things, and like having campus and the gym and everything nearby. Definitely I think I will miss that. And yeah, it's hard to sort of be away from where you've kind of spent the last few years settling. Like I've spent 3 years settling into Nottingham, and then I've kind of been plunged into a brand new environment and a brand new place. So yeah, I think that is definitely going to be one of the big challenges of fourth year for me. But I'm just seeing it as kind of an exciting experience, and I'm getting a lot of variety, and I'm having to sort of really sort of grow as a person, and I think that's not a bad thing, to be honest. I think it's quite nice sometimes to be pushed out of your comfort zone. So if you do end up getting a residential placement, just see it as a positive opportunity. And yeah, I definitely did have days where I would be quite upset about it and I'd wish that I was in Nottingham, but actually I'm trying to just see the positives now. And I actually love being in Boston in that we are literally staying on the hospital site, so we're so close, we've got no commuting, we just pop over to the hospital, pop back for lunch, and that's really nice, as opposed to having to drive for like half an hour every day to get somewhere. So there are always going to be positives. So yeah, I'm going to end that here. I'm sorry if I didn't answer your question. There's quite a few I didn't get through. Some of the questions are quite similar to ones I've answered, so I hope I've kind of answered them in some sort of way. Thank you very much for watching. Don't forget to follow me on Instagram if you want to get involved with Q&As in the future, or if you just want to kind of have a nosy about what I'm up to. And remember to subscribe to my YouTube channel if you want to see more videos about medical school, productivity, all that jazz. And yeah, I will see you very soon for my next video. Bye!